就算你冇特定痛症，都不妨定期去見下顱底骨師。
Hey, and welcome to Kate's Holistic Healing. I'm your host, Kate Fletcher, and I'm very pleased to have with me as my guest, Elizabeth Delabere. Welcome, Elizabeth. So, I guess the obvious question is, what in the world is craniosacral therapy?
Well, craniosacral therapy is a light touch, manual therapy aimed at improving the structure of the body, especially the central nervous system, by eliciting the body's self-corrective nature. Now, what's that mean?
Right, because everybody, right, okay.
So, I brought my friend Dana Scully. You can tell when I got her. I think that we have the image and the body sense that the head is a helmet.
Right.
And the truth is, it isn't. I mean, it's hard because it's bone. However, each different colored bone has independent movement. So there's actually play.
But wait, I'm sorry. But when you're an infant, I know that your brain moves. But
And the skull bones.
in the skull bone, this is adults.
Yes, people learn that the bones are fused.
Right.
Now, this is kind of funny because we all know of Gray's Anatomy and Dr. Gray from the UK, and anatomists that are descendant from Gray's school worked on preserved cadavers. So preserved cadavers have more fibrous tissues between the bones, and there's very limited play. So that created the myth that these are fused.
And they're not.
And they're not, because Dr. Sperino in Italy and his anatomists and other countries in Europe and the Middle East, they know that these sutures are only fused in the presence of pathology. So many things in our culture based upon this myth.
That is a myth. And so what is the reason that they move? I mean, is there a benefit?
Okay, so well, I think the body has, we don't think about this because it's very subtle. The body has many mechanisms to increase and decrease tone in the body. So we have sympathetic and parasympathetic in our nervous system. That means we're more excited and we're more restful. We have our breath. We have the inhale, which is more excited and expansive, and the exhale, which is more restful and condensing. And we have the cerebrospinal fluid, which is produced inside the cranium and creates an expanding movement, and it's absorbed slowly and creates a condensing movement. And this movement can be felt anywhere in the body. I can feel it on your feet. Any skilled practitioner can feel it, not just in your head and your sacrum.
And what are you feeling? I mean, this isn't the circulatory system.
No, it's the production and absorption of cerebrospinal fluid, which bathes the brain and the nerves inside the stocking, the body fascial stocking that's around the brain, between the brain and the skull bones, and comes down your spinal cord, through the vertebral column, inside the bony column, around the spinal cord, all the way down to your sacrum and coccyx. And then that tissue is continuous with the respiratory diaphragm, with the diaphragm that runs across our shoulders, with the pelvic floor diaphragm. And so it speaks to how something that happens in your knee could possibly pull up into your pelvic half or your sacrum and pull up through your spine and cause a jaw problem.
Huh. That's fascinating because, well, medicine doesn't look at it that way. They think you have a knee problem, they look at your knee.
Right.
And so it is all connected.
That actually reminds me of a case with Dr. Upledger, and I apologize, I don't remember the Olympic swimmer's name. There was an Olympic swimmer who had a dive, and she actually landed on her knee on the cement out of the pool, somehow impacted her knee. She began having vertigo. She was unable to compete in meets. She was having a lot of symptoms. Dr. Upledger evaluated her and said, "What happened to your knee?" And then she told him of this fall. And working with the knee, corrected what was happening in the vestibular system inside the temporal bones of her cranium, so that she was able to be symptom-free and compete. And I do believe she went on to win a medal.
That is amazing. So tell me, I mean, you mentioned that you can feel this movement and this flow of a practitioner. I mean, how do you do that?
So first of all, Dr. Upledger, he gave the world a great gift because it's because of his studies and research in the Michigan School District and with children with special needs and on the autism spectrum that he realized to do craniosacral therapy, you need good hands and a good heart. So I often describe to my clients, they want to know, they understand what I'm saying, but they still say, well, how does it work? And I read this a long time ago in an Ayurvedic text that when you cut your finger, the body knows how to heal, right? What do? We wash it, we keep it clean, we keep it covered so dirt doesn't get into it. But we don't have to instruct the body. We don't have to say, okay, start the clotting cascade, begin making fibrous tissue. It would clear the bacteria, white blood cells. It does. Our body knows how to be whole. And when I describe craniosacral therapy and I say it elicits the body's self-corrective nature, that's what I mean. You know how to heal. We need to support, right? So I'll evaluate, and I'm looking for this feeling in the body. And it's this tide-like rhythm. And I'm looking to feel this widening. If I'm on the feet, I'm looking to feel that widening and that condensing. And if I don't, I say, oh, there's some history here. Or there's some history somewhere else that's tethering this, which brings me to my next toy.
Oh, okay.
Unless you have a question. So we often talk about, oh, well, so-and-so's getting older, it's only natural, they'll have arthritis or back pain or a disc issue,
Right,
whatever.
you just have to deal with it, and it's part of life.
And I think that paradigm is incredibly faulty because I feel, now, yes, we have human bodies, they will show wear and tear and be vulnerable to injury and virus, etc. However, it's the accumulation of history and experience that is really what I feel contributes to aging. When we see someone who is pulled over to the side or pulled forward, there's experience that's held in the tissues that's creating that force. So let's say this is a body that's got good flow and it can expand and condense, but you sprain your ankle when you're a young child, and that subtle strain pattern affects how you use your right leg and affects that right side.
Okay.
And let's say that your parents get divorced, and because of the childlike mind thinking everything is their fault, you feel incredibly sad and grief-stricken, and it causes some constriction in your chest. And then maybe you get some asthma symptoms, or you're more vulnerable to bronchial conditions, and then maybe you have a horseback riding accident and you fall and you impact yourself on the side of your body. What's happened to our structure? What's happened to how well the circulatory system can function?
And how well everything can move.
Right,
It's
exactly.
now all tied up.
Right, so now there's immobility, there's stagnation of the lymph, of the blood, of the nerve communication. And so craniosacral therapy, now I have to figure out, I mean, that's sort of what we do. We feel, oh, what's pulling what? So you see how this side impact did something over to this side. And this heart strain, oh my goodness, I've created a puzzle I can't figure out. This heart strain caused something over on this end. And this ankle strain caused something up there in the shoulder, right? So when we're evaluating, I'll be on someone's feet and I'll say, oh, this right ankle has some history. And I can feel how it's related to something up here in the right hip or pelvic calf. Or, I have many people in my practice who've come to me for knee problems, and it's because of the appendectomy they had when they were a young child.
No kidding. And now how were you able to sense that in their body?
So this is the occiput, that's the bone in the back of your skull.
Okay.
And this is your sacrum, that's the bone at the bottom of your lumbar spine. This is the coccyx. The coccyx is really deep inside, and most of us unfortunately are sitting on it, and we really need to get off of it to have good spinal mechanics. But This tissue here is the connective tissue around the brain and spinal cord called the dura that I was speaking of earlier. So when the dura expands, it, unfortunately, actually this person needs some cranial work because look, they're a little twisted in it. So there, that's better. So this will expand, and I can't demonstrate that since I don't have fluid inside. And let's say this person fell on their butt. They slipped on the ice, they fell on their butt, and that sent a force up into their skull, and now they're getting headaches. Well, when I put my hand on their sacrum, there's not going to be any movement. Attitude, often when you see someone who does some sort of manual therapy, the attitude is, oh, this is really stuck, let's get it moving. Sometimes we do that, but mostly what we do is, it's as if my hand is saying, body, show me the pattern. And the body, or show me what's happening for you. It's really listening. And who doesn't love that?
No, I mean, you have an area, we have an injury, and it's crying out for attention, and it's suddenly getting it.
Right. So when you put your hand on the sacrum will not move because that shock, when that person fell on the ice, has inhibited that cerebrospinal fluid flow. It's inhibited that tidal movement, and there's no fluctuation. I should feel longitudinal fluctuation all along the spine, and quite a bit of it, over a centimeter. I mean, depending on how big the person is.
Really?
It is palpable movement if you have training. But this person who slipped on the ice and fell on their butt, no movement. Then,
so what can you do?
It will show me that it's pushed up into the lumbar spine and stuck there. And then this is what I mean by eliciting the body's self-corrective nature. I follow it. And the body, when something is restricted, we no longer get the sensory feedback of the movement there to our somatosensory cortex, the part of our brain that's receiving sensory, changes the motor output. It actually stops knowing that that's there because it's the movement that feeds back the sensory.
And if it doesn't have that, then it doesn't know, so it can't, but then how can it know to heal it?
Okay, so I'm listening here, and the body says, oh, this is my crude translation of what the body's saying. The body says, let me show you what happened to me. And maybe it pushes the sacrum up into the spine, and maybe it turns the coccyx, and maybe it turns me a little bit. And then I know that person fell more on their left ischial tuberosity than their right, because there's this torque, right? And then that movement and the touch of my hand and the feedback goes up into the sensory system. And the brain says, oh, what am I doing over there? I don't belong there. Because we all have an embryological blueprint. When the cerebrospinal fluid manifests is the moment in utero when the midline is forming in the embryo. So here I am on the sacrum. Here's my longitudinal movement I'm looking for, but the sacrum's doing that, and then the body says, what am I doing over there? And it starts sensing, that's not where I belong, and I might put a hand on the lumbar spine so it can actually feel, oh, that really got compressed. The body doesn't like feeling its tension. You'll notice this just with something simple. If you're uptight about something and then you realize, oh, my shoulders are up to my ears. Oh, I don't need to do that, right? As soon as we are aware, we realize we can stop. It's the same with the subtle movement. The body suddenly feels it's compressed and in a left rotation, and that's not its blueprint. And it starts releasing the adrenaline that has been stored in the nerves from when that impact happened. You start getting real tissue change, softening, heat discharge. People will say, oh, I feel that down the nerves of my leg. All this discharge happens. The tissue spreads. The body starts moving towards midline and reorganizing itself.
And it does this simply with you
supporting it,
finding what direction it wants to go in, and just...
Exactly. Now sometimes something's really stuck. Let's say this person, and sometimes, let's say this accident happened with someone who already was really tight in their body. I may give it a little nudge. I may actually compress it a little further so it can feel. And it really depends on the person. There are people who are really sensitive and just being with the fluid movement that is in the rest of the body, not here, but elsewhere, begins to make enough flow that the body actually just does all the work of, you know, if I am only being with and supporting it.
Why? It's just such an interesting concept that the body knows what it's supposed to do, because you're right, the finger can heal.
Right.
So we know the way we're supposed to be in, but it doesn't, but why don't we fix it on our own? Why do we need an intervention, a craniocecal therapy?
Because I think
The time?
we can get stuck. So this person who fell on the ice,
Yeah.
that created an area of immobility, and some people have a lot of vitality. Their cerebral spinal fluid, they feel like the ocean at high tide. It's very powerful. And some people it's very light, and those people maybe need a little more support to move through something. Their own. Some babies after they're born, their head will expand and reshape, and no problem. And some babies, first of all, maybe they have more intervention, and they really need extra support. It's very, very individual. I think it's a paradigm shift for us to think, one, that, well, I'm functional now, so that sprained ankle, you know, I can walk around, so it's fine. It's not fine. You need that force that came in to be removed, to be erased, for your body to rediscover its subtle movement. This person who fell on the ice may have a sore lower back, but eventually they'll get used to it, and then that will create faulty movement patterns that leads to what we call aging.
So people that are walking around with chronic pain, and they just figure, well, I have to live with it because I've got a bad back, I've got a bad knee, hip, whatever. And the medical community might tell them, well, there's nothing else we can do surgically to improve this.
Actually, what I'd love to see is for people to try something like this, or even acupuncture, although that's a little more indirect because it's such an energetic modality. It doesn't have as much of a foothold in the structure, medication and surgery. They can always go to that if this isn't effective. But this person gets help with their herniated disc. I've had people come to me, one session, their herniated disc is gone. One session, their bladder incontinence is gone. Now I will say that doesn't always happen, and it really depends on what else is going on in your body and your mind. But it's an effective modality.
And how does the mind come into play with it? Because you said you have to have the right thoughts as you're working on a person. But do people, can we get in our own way?
Well, I find that people will say, well, what if I don't believe it or I don't feel it? Will it still work? And it will. But I find that the mind, if your mind is in a state of black and white and kind of holding tightly to your belief system, that affects your system, your body system, your fascia. It creates more tension and more tone in your tissues than if someone who says, okay, I trust that I'm on your table because this can support me and assist me in my healing. That person has a totally different, they're less acidic, their tissue, and because they're less acidic, their tissue tone is softer, more pliable, and sometimes they have to participate. Sometimes people will come to me for left hip pain. They have a short left leg, and I'll say, well, this is a consequence of something going on in your small intestine, because the small intestine, I don't know, let me use a different example. Let's just pretend this is my small intestine. So the small intestine is tight and inflamed, and the fascia around the small intestine is pulling down into the leg. And it's shortening that left leg and drawing that thigh bone more tightly into the socket. And so that person will develop arthritis in that, or actually maybe in the other side, because, and I'll say, well, I can get it moving, and they'll stand up and they'll be confused because that left leg will hit the floor sooner because it's longer, but then it'll come back. And then I need their participation in thinking about what are they doing, what are the emotions going on, because we all know the gut brain, there's all this research now of how our emotions may even come from there, right? But certainly it's responding to what we're feeling. There's this dance back and forth. And so I then require their participation, and that's why I say the mind, because if someone isn't willing to look at dairy or gluten or sugar, they've got a chronic yeast problem, and they may not it may not show up digestively. They may think, oh, well, things go okay down there, and but they have back pain or they have hip pain. And that's the way the body's communicating that something is off in the digestive system, and people don't know. So I need a certain amount of open-mindedness sometimes in the client if they really want to move forward. The body that isn't moving is like a magnet, and it slowly pulls things towards it. And then before you know it, your appendectomy is causing a disc issue, or tension in the right sacroiliac, or a knee issue, or pulling up and doing something to the spine or the clavicles or the cervicals, and therefore the temporals and the occiput shift, that's these bones and bone and back, and then your jaw is up the crick. Let me actually explain that, because this many of your viewers, this is, and many of my clients, people come to me, and thank goodness they'll say, my dentist said to find someone who does craniosacral therapy, which is a wonderful thing that they're now referring, because they realize if you work on the mandible in isolation, it doesn't work a lot of the times. So the mandible is one bone, but
it's your jawbone.
It's your jawbone, thank you, be my translator. But it's got a socket on each side in these bones on the side of your head here. So that person who fell on the ice and that impact came up into the occiput, and it torqued the occiput also, because the occiput will do what the sacrum does. If something happens down here, the occiput has no choice but to be a mirror, because we need our eyes level with the horizon. There's all kinds of writing reactions that we have that the body will just do, and you won't even know it. So then the occiput pushes these bones, and now the sockets, where this bone goes into, instead of being like this, which would give you a nice swinging mandible, they're like this. What's the poor mandible to do? How will your jaw ever be happy? It can't be. So many times, when we talked about the knee, a jaw problem is not a jaw problem. I'm aware of a client who said, she said, Elizabeth, I think this is my 8th session, and I came to you for TMJ dysfunction. You haven't touched my jaw once, but I no longer have jaw pain. Because it was about her pelvis.
Right. That is fantastic. So what happens if people are having issues, which most people do, how can they get in contact with you? And thank you all for tuning in.
Roy Culver loves to run, and he's good at it too. In 1997, he came within 4 seconds of beating the Alberta provincial record in the 3,000 meter. For his mother Camille, it's something of a miracle. Roy Culver's story begins here with another miracle, the miracle of birth. But for Roy and his mother Camille, it wasn't an easy beginning.
Roy was a real textbook pregnancy. Everything went fine, and this baby moved and moved and moved. And about a week before he was due, he just stopped moving.
Not long after Camille went into labor, complications set in. The baby became stuck.
I guess I was expecting them to say, well, we'll have to do a cesarean again. But they said, the baby's too far down. We can't do a cesarean now. And there were a lot of, forceps were put in place. And I remember thinking, what is this doing to my baby's head?
Roy Culver's first experience with the world outside the womb had left its mark.
He was bruised, which you expect with forceps. What I didn't realize was that it had an effect on his jaw. It wasn't sitting in joint as it should be. It explained why he had trouble being understood. He didn't speak very clearly, so it made it just easier not to talk.
The physical effects of Roy's birth were obvious. but the emotional one became more apparent as he grew older.
Roy always, stood on the outside, assessed the situation, and was very cautious. It was always like he was never really sure if he was going to be accepted. So, in a lot of ways, I do feel his birth had an effect on that. Well, his energy level was extremely low, especially as a toddler. It was really low because he didn't crawl, because he didn't have the energy to crawl. And then when we started with the gluten-free diet, he got up and started walking.
Camille set up an appointment to take Roy to see a craniosacral therapist. It didn't take long for her to know that she'd made the right decision. Carlene Daphne treated Roy as she does all her patients, with the gentle, healing touch of craniosacral therapy.
Because of the known trauma that Roy had, and because of the appearance of his face, and because of what I was able to tell when I put my hands on Roy's body, feeling for the craniosacral motion and the craniosacral rhythm, it was very clear that there were large areas of restriction in the connective tissue inside the head and in the rest of the body, the diaphragm. Roy was also quite bent over. He couldn't stand straight. The tissue inside his body was pulling him into this position.
The craniosacral therapist explained to us when she first had her hands on him that his diaphragm was all pulled up, and that's one of the first things she did through cranial was relax his diaphragm, and he just went, oh.
You don't really feel much. You sort of feel like there's just a hand resting there, and then sort of a bit of tension, then all of a sudden she'll sort of let go and it will release, and you can actually feel your face sort of move. Like,
he walked in the door after that first treatment. My husband looked at him and said, Roy, you're taller.
I noticed a profound difference in his facial features. It had really moved his jaw visibly, and it was remarkable.
At first glance, the human skull looks like a helmet, solid and immobile, a protective shell for the brain. When the bones of the skull are moving normally, cranial rhythm is balanced and we enjoy good health. When we suffer a trauma, injury, or are exposed to a toxin or even emotional shock, the normal motion of the skull can be affected, which alters the cranial rhythm. That, in turn, can affect other bodily functions. Roy's jaw and teeth had always been a problem. His lower jaw was overextended, and his upper and lower teeth didn't actually touch, which made eating very difficult.
When she put her hands in his mouth and did some craniosacral with his actual upper jaw, it was just amazing the color he had in his face. And I looked at him, and he had cheeks, whereas before they were sort of always sunken.
I noticed the first thing was when I got home and I had dinner, I never really knew it was hard for me to chew, but then I seemed to chew so much faster and so much better.
In the first month of treatment, Camille brought Roy to see Carlin 3 to 4 times a week. Camille watched as her son's condition improved dramatically, not only physically, but emotionally too. With proper nutrition and scheduled visits to the craniosacral therapist, Roy continued to improve, and he discovered a hidden talent. The boy who could barely crawl as a baby could run so well that he caught the eye of the track and field coach.
He was kind of pulled out of phys ed class because he had run well that day, and the teacher had said, well, run in the school track meet then, and Roy said, okay.
Camille and her husband watched from the sidelines as Roy raced in the 3,000 meters.
The gun goes off, and Roy runs out in front. And the people sitting beside me are saying, boy, Roy better slow down. I mean, he's got 6 laps to go.
It's difficult to run when you're with the rest of the crowd because they're passing and doing things. So I thought, if I can get ahead of these guys, I'll have a much easier time running. When I got ahead, I found it really easy just to keep going.
He just set his mind to, no, I want to win this race. I was really happy for him because it really paid, it was something that finally paid off all his hard work and self-discipline that he does on his own.
it's made a lot of things easier. I mean, there's the whole jaw thing. I mean, I'm a lot taller because of it. Like, I probably would be 4 inches shorter.
His attitude is better. I think he's more positive, and I think he's overall healthier. I think it improved his health a great deal.
A few days after winning the race, he came home and said, "Everybody knows his name at school now." It was nice.
Coming up, from PMS to pregnancy, do-it-yourself remedies that put women's health care into their own hands. But first, exercise for the body, inside and out, next on Beyond Medicine.
Hello， 大家好，今日尋找品牌的故事嚟到觀塘，尋找施博士顱脊工房喎。聽個名好似同脊骨有關喎，咁我成日腰酸背痛咪啱晒咯。啊，冇咁簡單，咁到底佢係做啲咩嘅咧？不如大家跟我一齊嚟啊！
萬里豔陽斜照，心興奮怎麼遮掩？回味撞人無數，天真的可愛笑臉，沒有了困倦煩惱，拋走了世俗負累，來共醉於此刻歌聲裏，譜出溫馨美妙，多動人尋夢調，傾出光輝歲月，翻起了生命力。
我哋到啦！咦，阿哥，
睇嚟真係唔簡單。
施博士
，Hello Katrina。
你哋喺度做咩啊？
我哋啱啱介紹緊客人認識頭顱骨對健康嘅重要性。
咁即係點啊？
就咁講就好難講㗎。如果阿 Benny 唔介意嘅，就做我哋 model，等我哋介紹一下呢個顱脊治療俾大家認識一下。好啊。
好啊。施博士做緊㗎啦。
係啊，我哋嘅顱脊治療嘅特色咧，其中一個咧就係輕觸式同埋無痛啦。其實咧，我哋咁樣咧做緊咧，就等於以手代針咯。
吓？乜手都可以代針嘅咩？
係啊，我哋就喺啲經絡上邊咧，去幫佢處理嗰個能量上邊嘅調動啦。所以維基解碼咧，都將顱脊治療咧譯做咧氣功。咁但係我哋其實咧就唔係咧如來神掌嗰啲咧法器。我哋咧係將嗰個能量管道咧去做調息。
咁病人需要做啲咩配合咁樣㗎？
我哋一般咧都會忠告病人咧喺治療前咧就放鬆自己啦。咁喺治療當中咧，盡量咧就係想笑就笑，想喊就喊，想鬧就鬧，想喐就喐，想瞓就瞓。因為咁樣咧都係我哋咧身心治療裏邊咧其中一啲嘅情緒上面釋放咧重要嘅療效嚟嘅。
咁除咗做腳之外，仲有邊啲部分係要做嘅呢？
其實咧，我哋全身嘅經絡都做得啦。咁腳其實咧都係一個重要嘅所謂全息嘅反射區啦。咁所以好多人都會做腳底按摩啦。咁但係另外一個重要嘅位置咧，除咗脊骨咧，就係個盤骨。咁我哋陣間咧都會示範一下咧喺個盤骨上邊咧點樣去調息佢呢一個嘅能量嘅管道啦。咁另外頸椎都係一個重要嘅位置，而最重要嘅重點咧就係我哋嘅頭骨咯。咁所以我哋有大部分嘅手法咧都會喺頭骨上邊咧做處理嘅。
咦？呢個手法可以治療到啲咩嘅問題？
呢一個咧就係我哋俗稱嘅丹田嘅位置咧。男士嚟講就可能腎啊、膀胱啊或者前線啦。咁甚至個腰骨啊、坐骨神經啊咁樣啦。咁女士嚟講咧就係所有嗰啲嘅婦科嘅問題啦。我哋臨床上面有一啲有子宮肌瘤嘅病人咧，透過咁樣嘅治療咧，都可以令到個肌瘤咧一路收細，收到去冇都有嘅。咁呢啲都係臨床上面一啲嘅療效嘅一啲嘅例證啦。
其實都好似好舒服咁喎，你又唔使喐佢，又唔使喐佢，又好似唔痛咁喎。
係啊，呢個呢就係一個好鬆弛嘅狀態啦。我哋而家做緊呢個位置呢，就係頸椎啦，同埋個鎖骨。 咁都係一個重要咧嘅一個情緒中心嘅釋放嚟嘅。咁而家佢個反應咧都係一個咧我哋臨床上邊咧好想去達到嘅一個治療嘅效果啦，我哋叫做醉夢。咁佢個人咧其實咧就係半夢半醒啦，但係個人咧係清晰嘅、清楚嘅個意識。不過人咧就去到一個好鬆弛嘅狀態，咁有時咧就會不自覺咧有好多唔同咧嘅反應啦。間唔中咧頭先譬如阿 Benny 咁樣咧個頭咧會有少少擰一擰啦，間唔中有啲手指啊腳啊有時都有啲跳動嘅，咁嗰啲都係一啲好好嘅釋放反應嚟嘅。
咁一般嘅療程係做幾耐㗎？
多數平均咧我哋會係45分鐘至到1小時啦。咁如果做一個整全嘅療程，我哋就先由腳做起啦。跟住可能做咗盤骨啦，做個頸椎啦。咁而家呢個位置其實都係我哋講咧叫做一個頭顱骨同埋脊骨最重要嘅一個位置咧。咁我哋做緊呢一個牽引咧，其實咧就可以幫我哋減低咧身體嘅壓力，無論係身心嘅壓力咧，透過個脊椎神經嘅鬆緩咧，都可以幫我哋咧處理到嘅。
咁通常嚟幫襯你嘅都係咩年齡嘅朋友仔呢？
就個年齡層都好闊嘅。最細嘅應該係細過0歲，即係咧其實喺媽媽個肚裏邊咧都可以接受我哋啲治療嘅。咁最大嘅年紀咧，我哋去到90幾歲。咁所以咧，我哋嘅治療咧，其實0至100歲，其實唔同嘅生物都可以接受我哋嘅治療嘅。我哋有啲病人咧，就曾經幫過佢哋自己養過嘅動物啦，狗仔啊、貓仔啊、倉鼠啊。我哋試過最特別嘅咧，有啲病人就幫佢養緊嗰隻龜、金魚，咁都曾經接受呢啲治療咧，而產生一啲即係健康嘅作用同埋療效咯。
頭先你話咧頭就係重點啦，咁你而家做緊呢一個咧又係咩手法嚟嘅咧？
係啊，因為頭骨裝住嘅就係我哋嘅大腦啦。其實我哋100%我哋身心靈嘅功能咧都係個大腦。咁如果我哋將個治療咧，除咗話以手代針做針灸，其實我哋就係做緊心同埋腦嘅一個按摩咯。其實而家我係幫緊佢嘅大腦去按摩咯。呢個手法其實就可以促進咧佢個腦脊液嘅流動啦，咁一啲淋巴嘅阻塞啦。咁我哋叫呢個手法咧就做顱關通啦。咁都係好舒服、好舒暢嘅一個手法嚟嘅。
大腦都有得按摩，即係第一次聽啫喎。咦？呢個手法咧好似撳住個太陽穴咁喎。咁平時咧，我哋成日有嗰啲偏頭痛啊、頭痛嗰啲咧，係咪好有效㗎？
係啊，我而家做緊呢個手法咧，都係我哋頭顱骨顱脊治療嘅一個重點手法啦。我哋叫佢做顱蝶鬆。蝶其實咧就係我哋頭骨裏邊最重要嘅嗰塊顱蝶骨。咁你見到咧，其實就算 Benny 咧，而家咧只係我哋幾分鐘嘅治療咧，佢都係好鬆弛嘅。咁甚至你見到佢有少少口部嘅動作啦，膊頭又會縮啦，手指又會喐啦，呢啲都係佢模糊意識嘅咧一啲嘅釋放嘅動作。咁所以呢一個治療咧，尤其是呢個手法，對於我哋壓力啦，因為都市人咧而家好多嘅身心壓力不適症候群啊。其實世衛咧都講咧，心病咧將會成為咧我哋咧第1號殺手啊！咁所以咧情緒上面嘅處理啊、壓力嘅處理啊都係好重要嘅。
咦？呢個動作好似掹緊耳仔咁，會掹下耳仔咧，異性好啲嘅咧？
嗱，你真係講得啱啊！呢一個手法咧，我哋叫做顱列牽。其實拉耳仔咧，原來咧就可以幫我哋咧促進我哋嘅記性啦，將我哋一啲睡夢上面嘅失調咧，譬如好多人啊會發惡夢啊，甚至夢遊啊，甚至即係完全記唔到自己有發夢啊，好多夢啊。咁原來咧呢一個手法咧都係好好臨床上邊咧嘅一個幫助嚟嘅。
啊，呢個我知，呢個我上網睇過你啲片，呢個係顱四壓 CV4。
好嘢喎，係啊，呢個咧就係我哋 CST 啊 Cranial Sacral Therapy 嘅創辦人 Upperger 咧佢嘅重點手法。呢個手法嘅作用咧可以淨化我哋嘅腦脊液，即係話做完咧有美白嘅效果。呢個就係徒手嘅美白手法，做完咧10分鐘到咧，好似敷完咧好名貴、好有療效嘅面膜一樣。呢一個咧亦係咧按壓住咧我哋第4個腦室啊，咁原來咧可以促進咧我哋睡眠嘅質素。咁或者不如我哋咧都示範埋咧最後一個 round up 嘅手法啦。其實我哋叫呢個咧做任督搖滑。咁呢個作用其實最簡單嘅，其實咧就係打通佢嘅任督咯，就等於《黃帝內經》咁樣講啦，通則不痛，不痛則通。任督就係最重要我哋身體上邊咧嘅經絡嘅能量嘅管道。
人尋夢調，傾出光輝歲月，翻起了生命浪潮。 涼熱似鬥志，彷彿勁草於急風，盡興於風中蹦蹦跳。願你我珍惜一分一秒。問哪裏永沒爭鬥，問哪裏永沒污染，願看見美麗天空星光閃。誰沒最百事囉嗦，愁着臉說話多多，寧願每一天開開心心過，無謂怕講一聲 I love you。萬里豔陽斜照，心興奮怎麼遮掩？回味撞人無數，天真的可愛少年。
相信頭先咧，施博士為大家示範嘅手法咧，大家都好少見嘅。咁其實我自己都好少見嘅。咁我想問下施博士，你創立呢一個顱脊工房，其實係有啲咩淵源嘅咧？
要講淵源呢，就有幾個重點啦。第一個重點其實先父咧都係因為呢一個急性腦膜炎。咁喺我考 A level 之前幾個月，佢就晏晝就昏迷，夜晚咧就已經即係返咗天啦。咁所以醫生咧就甚至話佢咧，因為喺醫院留醫唔夠24小時就去世，咁仲要解剖。咁但係最後俾我嘅答案咧都係原因不明啦。因為我對西醫咧有一啲情意結嘅，但係對於我嚟講咧，傳統嘅醫療咧，因為我自己個人嘅經歷啦，我先父嘅經歷啦，佢唔單止救唔到命啦，又醫唔到病啦，甚至令到我爸爸咧都係死無全屍嘅。咁所以我喺理大一畢業嘅時間咧，我就自己去再讀中醫啦。其實都想尋求一啲健康嘅資訊啦。咁其中一個最大嘅方向都係解釋俾我自己聽，點解爸爸53歲先前又冇乜大嘅病，咁快咧就離開咗我。咁另一個淵源咧，其實就係到2003年啦。咁喺沙士嘅期間，其實嗰陣時我已經係私人執業緊物理治療嘅工作。咁但係原來咧，我因為咧幫一個咧患咗沙士嘅病人，不過我哋又唔知道，就幫佢拍痰同埋聞氣。咁然後咧，我哋同我個姑娘咧都被感染。咁但係我哋唔知道。咁但係我自己咧就返咗屋企咧，其實我有3日3夜咧，基本上係起唔到身，個身體又好痛啦，又反覆地發燒啦、出汗啦，食嘢又冇胃口啦，自己屋企做任何嘅方法咧都冇辦法處理。不過咁樣俾我捱過咗3日，就好似新加坡咧用呢一啲方法咧處理沙士，隔離咗啦，只係飲水啦，同埋咧就係休息啦。咁原來咧我哋嘅身體咧有一個咁樣嘅先天咧嘅治癒嘅能力。咁其實就係因為我沙士康復咗之後，喺一個物理治療嘅一個 bulletin 嘅月刊背後嘅一個廣告，就講呢一個咧叫做 cranial sacral therapy 咯。咁嗰陣時我對呢個字咧都係唔係好理解嘅，不過我淨係睇到佢一句説話，佢講佢可以 enhance 嗰個 self healing。即係話咧，原來可以促進咧我哋自身嘅治癒力。咁啱我又喺沙士咁樣康復咗過嚟，咁所以對佢嗰個治療咧就好有興趣啦。咁就即刻報讀咗咧喺黃竹坑醫學院嘅一啲嘅課程。咁點知一接觸咗咧就即係入迷啦。咁我就即係好中意咗呢一個治療嘅手法啦。咁一路去自己去進修啦，去研究啦。
咁其實咧，其他嘅醫療人員咧，佢哋都有用到呢一個技術，但係都只係輔助形式。點解你會咁專注喺呢一個顱脊治療上面呢？
嗰陣時我已經係私人執業，做緊我自己物理治療嘅工作，我係當送俾啲病人嘅。不過喺我哋做咗一段時間之後咧，偶爾有啲病人咧就咁樣走嚟同我哋講喎，嗱，我今日咧就趕時間。其他嗰啲咧超聲波啊、咩拉頸啊、短波啊，所有你都唔好幫我做啦。我淨係做咧，你平時咧做完咧，淨係幫我捧住個頭。你話唔知咩叫顱脊定乜嘢，我唔知你個名啦。咁你總之咧就幫我做10分鐘嗰個做頭。嗱，錢我話照俾，我俾足你㗎。不過我覺得最有感覺咧就係嗰個咁樣嘅手法。咁啲病人佢自己真金白銀俾錢㗎嘛，咁當佢咁樣講嘅時間，我就會覺得呢啲療效咧，原來唔係淨係書面講嘅一啲咁樣嘅理論，咁原來真係實際咧有一個療效。咁結果我後來就摒棄晒所有其他嗰啲嘢，我就專注咧，淨係做我自己講緊嘅呢一個顱脊治療咯。
頭先見到咧，你同病人做嘅手法咧，又唔使喐，又唔使用力，咁病人又唔使食藥喎。其實呢個顱脊治療係點樣有嗰個療效嘅呢？
其實咧最重要嘅咧，原來我哋係促進咧我哋自身嘅免疫力、自身嘅治癒力。其實咧呢度有本書咧都值得介紹俾大家嘅，咁呢本書咧叫做《治癒力》， 咁英文嘅原著咧，佢其實就係叫做 spontaneous healing。咁啊，作者其實咧原來係全世界最具影響力嘅25個嘅即係首位之一。咁啊，入邊其實咧就係講佢咧巡迴咗大半個地球。佢喺哈佛醫學院退休嘅時間咧，周圍去做一啲專訪，了解唔同嘅醫療咧嘅手段嘅結果。佢嘅總結咧就係所有醫療嘅從業員、所有嘅儀器、所有嘅藥物，嗰個都只係一個工具。真正能夠令到我哋好返嘅咧，原來我哋就係有一個咁樣嘅先天免疫治愈力嘅機制。我哋用住一啲統計上面嘅資料，去評估病人嗰個嘅存活率啦，或者治愈率啦，咁嗰個係啱嘅，因為我哋用住嗰個統計學嘅結果。但係我哋生命上面其實充滿咗好多嘅未知之數，充滿咗好多嘅奇蹟，甚至我哋咧，好似我哋出邊嗰塊鏡片嘅一個牌匾嘅一句説話啦，曉得感恩，我哋就能夠咧有奇蹟，奇蹟就再生。而我哋嘅重點咧就唔係淨係幫緊身體嘅問題，係一個身心結合嘅療法。
好啦，咁施博士，咁其實你一個病人平均1個鐘頭一個啦，其實你一日都做唔到好多個病人嘅啫喎，你會唔會有其他渠道係可以繼續去幫更加多嘅人呢？
係啊，所以我哋都效法咧，我哋即係顱脊治療嗰個 founder 咧，就教導一啲咧可能冇任何醫療背景嘅人，咁都可以學習呢一啲頭先我哋講解嘅手法啦。咁所以我哋咧都有搞好多唔同嘅課程啦。咁有一啲係簡單嘅工作坊啦，有一啲係一啲基本嘅實習嘅班啦，家居可以應用嘅啦，甚至我哋會為專業人士提供一啲臨床，可以喺佢嘅工作上面作為一個輔導嘅一個技術啦。咧我哋又整咗一啲嘅網上嘅一本書，咁我哋有繁體字啊，仲有簡體字。我哋希望喺年尾咧可以咧將呢一本書咧就出版啦。咁所以我哋咧都有2句總結嘅，我哋就係觀念改變健康。我哋徒手可以助人自助。
好啊，施博士，咁首先祝你哋嘅書籍大賣啦，亦都好多謝接受我哋尋找品牌的故事嘅訪問，講咗咁多關於你嘅故事啦，同埋顱脊治療嘅資訊俾我哋。見你講到咁正，我都好想試下喎。
好啊！
治療咗6、7次，嗰個心跳亂嗰個問題解決咗。我女係瑞士做嘢，即係我個女喺網站嗰度睇到你哋嘅廣告啊，佢知自己咧都學過嗰個。
萬里豔陽斜照，心興奮怎麼遮掩？回味撞人無數，天真的可愛笑臉，沒有了困倦煩惱，拋走了世俗負累，來共聚於此刻歌聲裏，抱着溫馨美妙，多動人尋夢調，傾出光輝歲月。
Because in craniosacral therapy, it's very important to have that free movement of the sacrum in between both hip bones. I personally see a lot of people that have chronic pain, that have trauma or high anxiety or have tinnitus or whiplash or concussion, and then I work a lot with the head and the bones, and I assess the movements that the bones make. In the skull, I work with the intracranial membranal system inside the head, which is the tissue inside your brain. And if there's been a fall or even severe trauma, then usually this is quite impacted, and I would feel for that and try and nudge that along to come back into balance and to in alignment. Another thing that we work with is sinus problems. This, for instance, is your superior sagittarius sinus. We will work with that to get the fluid better flowing again and to address any sinus problems, congestion, restrictions that there might actually be.
我哋唔會俾過多嘅，因為如果我哋順應頭先嗰個自愈全身五部曲，我哋係 feel 住佢嘅筋膜嘅流動，去帶動佢嗰個身體嘅反應。咁嗰個係佢身體做主導，唔係我哋嘅計算。咁所以唔會過多嘅，佢夠咧佢就唔會 take up 㗎啦。咁所以頭先你話做幾耐咧？任何一陣洋葱皮嘅釋放都係一個好嘅治療嘅效果。喺我哋唔知頭唔知路，個 client 又唔知頭唔知路，原來 approach 話咧咁樣咧都有咧20% 大師級嘅療效。